Joining us now to break down the latest developments in the government's response to the crisis is Representative Ron Estes, the congressman serving Kansas's 4th District. Congressman, you recently wrote an op-ed, which I thought was very interesting, about the idea that it shouldn't be necessarily the job of the federal government right now to bail out certain states. And I think it's an interesting debate that we've heard take place between New York Governor Andrew Cuomo and Senate Majority Leader Mitch McConnell over the past couple of days. But can you give us your perspective on that argument as well?
Well, I think the biggest thing around that is, the federal government has been focusing on two things. One, how do we protect the disaster that's related to the healthcare issues? And two, how do we get the economy going? It just doesn't make sense to increase federal taxes on citizens of any of the states to send that money to Washington, where some of it's then spent on administrative cost, and then turn around and send it right back to the states. Makes more sense for the states to be able to make their decisions about what's best for them, how to work within their boundaries for their issues. And each state's going to be a little bit different in their needs. And at the end of the day, we don't know exactly how much the tax revenue is going to change for each state. So whatever program we came up at the federal level would probably be wrong, because it would treat some states better and some states worse.
And when it comes to the idea of shutting down economies or opening them up again, it seems like the goalpost has moved a little bit, at least when it comes to the media. At first, for example, I remember the media was very critical of President Trump for not shutting things down earlier. And now when it comes to reopening the economy, we see that it's not necessarily the job of the president to do that. It's the job of the governors of these individual states to make that determination. And so acknowledging that point, what do you think those governors should be looking out for as they move forward, making the decision of when to reopen the economies?
Yeah, so it really it has been the role of the governors of the respective states. And so the president did get treated unfairly in that process. But, as we look at in Kansas or we look at other states across the country, the whole purpose for having the stay-at-home orders was to flatten the curve. And by flattening the curve, it wasn't to end all of the COVID-19 infections, but it was to make sure that the number wasn't so high in any one month or any one period of time that it overwhelmed the healthcare system. And so flattening curve was designed to prevent that, and it accomplished that. We've seen that even in New York. It hasn't overwhelmed their healthcare system. And so now it's time to get the economy back going again. We need to be prudent in terms of the process we're going, and the different states and different governors are looking at that. The White House and the administration has developed some recommended guidelines on what they ought to look at as each governor is opening up the state. And so I think it's important for us now to get that process moving again. And at the end of the day, having an economy going is going to help generate more tax revenue for the federal government as well as for the states, so they can get back on their feet.
And we already do see some states taking those actions in order to at least begin reopening their economies. Texas is the latest one today, as well as Ohio. Yesterday, I believe Tennessee, Mississippi, and Montana began taking the necessary steps. But there are some states for the time being that are not reopening their economy. They're looking a little bit more for an extended lockdown. And that puts an added emphasis, in my opinion, on the PPP program, the Paycheck Protection Program, and the loans for small businesses, because a lot of these businesses right now aren't making a profit, let alone paying their workers. What has the progress and the success been on that program so far?
Yeah, as you mentioned, some of the states are going to open up at a different rate, and that's the decision they have to make. And may actually even have them to look at increased infections in the future. But the Paycheck Protection Program was such a great program. I mean, we knew when we crafted it into the third stimulus bill, the one that's commonly called CARES Act, it was so supportive. Our overall goal was to make sure that we didn't force so many people to go on the unemployment system, and that secondarily we kept the employees connected with their employer, so that as we get through this peak time, that we're able to reconnect. The employers are ready to start up and open up their business. The employees are ready to go back to work. And so the program was so successful. Obviously, the first tranche of money, the $349 billion, was completely subscribed to in 13 days, which is amazing to think through that's the amount of money SBA loans in 14 years. And that was all accomplished in a 13-day period. And so we had to go back in and put additional funding in there to make sure that we address that and help support that. That program has been so well received by financial institutions, banks, and credit unions, as well as so many small businesses.
And you bring up the idea that that was the third such bill, and now there's talks about a possible fourth one as well. Some of your colleagues saying we should wait to see until what happens when the economy starts opening again before we address another stimulus package. Do you think that's the route to go?
So I do think it's right to go. Actually, with what we passed last week was technically the fourth bill in terms of the adding the additional money onto the Paycheck Protection Program, as well as adding additional money onto the healthcare system and for testing, as well as into the SBA Economic Injury Disaster Loan Program. So technically, we've passed four bills. There's talk about a fifth bill. Of course, only in Washington can we call it a fourth one, even though it's the fifth one. But I think the right approach is let's look at how our money is being rolled out, how it's affecting things. We don't know today how well all the programs are working. We don't know if there's more money needed in a particular area or less in another area when we looked at a new bill. So before we create this fifth bill, let's make sure that we're looking at what makes the most sense and making sure that we're seeing the best effect of all of this money that's now being rolled into the economy and being rolled into helping some of those healthcare costs.
Yeah, and of course, this is all dependent on how successful these states are moving forward after they reopen their economies. We may be seeing another lockdown for all we know. If, for example, the cases surge, the death toll surge, we hope that's not the case. But the next couple of weeks, I think, are going to be very important in telling regarding what other states will do, as well as you and your colleagues will do over the coming weeks and months responding to this virus. But Congressman Estes, always a pleasure talking to you. Thank you for joining us tonight.
Thank you. I appreciate that.